morning, everybody. It's your host, Alyssa Cortez, and today we have something very important to talk about. It is the effects of tobacco on women. In 2014, nearly 17 out of every 100 U.S. citizens aged 18 years or older currently smoked cigarettes. This means an average of 40 million adults. Cigarette smoking is the leading cause of preventable disease and death in the United States, accounting for about 1 out of every 5 deaths per year. Smoking and using tobacco is extremely harmful to men and women of all ages, but some effects pertain specifically to women. In the United States, over 18 million adult women and 1.3 teenage girls currently smoke cigarettes. They are putting themselves at risk for heart disease, heart attacks, strokes, lung cancer, emphysema, and other life-threatening diseases. In 2014, the U.S. Surgeon General reported that women's risk for smoking has risen significantly, and women who smoke are just as likely as men to die from smoking-related diseases. These diseases include cardiovascular diseases. Cardiovascular diseases are the #1 killer of both men and women. Each year, roughly 300,000 women die of this disease. Smoking is the leading cause of cardiovascular diseases, including coronary heart disease, arteriosclerosis, and stroke, among others. Women smokers also have a higher risk for developing cardiovascular diseases than men. The reason for these differences are not yet known, but could be due to tobacco smoke having an adverse effect on estrogen. Another disease caused by tobacco is lung cancer. An estimated 72,160 women will die from lung cancer in 2016. Smoking causes 80% of all lung cancer deaths among women. In 1987, lung cancer surpassed breast cancer to become the leading cause of cancer death among women. Smoking is also a known cause of other cancers, such as cancer of the lung, oral cavity, bladder, liver, pancreas, kidney, colon, rectum, stomach, blood, and esophagus. The reason why smoking is Get her out of here.
That was you.
A reason why smoking is extremely harmful and dangerous for women is because it reduces a woman's fertility. Women smokers tend to take longer to conceive than a woman non-smoker, and women smokers are at higher risk of not being able to get pregnant at all. Furthermore, more cigarettes smoked per day are associated with decreased fertility rates. Smoking is also known to cause ectopic pregnancy, a condition in which an embryo implants itself outside the uterus. Ectopic pregnancy is a very rarely survivable condition for the fetus and is a potentially fatal condition for the mother. Smoking during pregnancies can also cause spontaneous abortion, stillborn births, and sudden infant death syndrome. Other birth defects include abnormal blood pressure, cleft palates and lips, childhood leukemia, childhood wheezing, respiratory disorders, eye problems, attention deficit disorder, behavioral problems, and other learning and developmental problems. Other risks for women who are smokers include women who smoke are more likely to have menstrual problems, including painful periods, irregular bleeding, missed periods, and early onset of menopause. Cigarette smoking is a risk factor for osteoporosis and can become a more powerful factor among today's youth who have begun smoking at early ages. Women who are current smokers increase their risk for hip fractures, and postmenopausal women who are current smokers have lower bone density versus women who have never smoked. Based on these facts, there are many reasons to quit smoking. If you yourself want to quit smoking, go to smokefree.gov. Thank you.